Joint pain or inflammation is common in our society. This pain usually occurs in women rather than men. To treat this condition, doctors prescribe a lot of medicines. Many patients recover with medicines, but some patients can't recover after the continuity of medicine. So doctors prescribe surgical operations to such patients. The doctor performs surgical treatments to reshape the bones or recover damaged ones. The most common treatment is osteotomy in them. The first successful osteotomy in the world occurred in 1835 by Georgia Walton in the state of USA, Pennsylvania. Osteotomy is a surgical treatment in which the length of bone gets small or long by adding or cutting the bone or correcting its alignment. Through osteotomy, we can fix crooked bones. Osteotomy can apply to different joints or bones of the body. Some of the common types we discuss here. Hip osteotomy. In this procedure, the doctor reshaped the hip socket and, through this hip socket, correctly covered the hip joint. Knee osteotomy. Any person who does not have a straight kneecap or due to arthritis suffers from inflammation. It can be so painful for patients. Doctors perform knee osteotomy to normalize it. In this process, they cut or reshape the tibia or femur. Tibia and femur are the names of leg bones. Spine osteotomy. During this process, the doctor removes wedge-shaped bone from the spine and corrects the spinal alignment. Jaw osteotomy. Few people eat food, and their teeth do not line up properly during bites. The osteotomy is usually performed to normalize this condition, known as mandibular or jaw osteotomy. In this process, the lower jaw moves to perform this surgery. Big toe osteotomy. In this process, usually cuts the segment of the toe bone to normalize the size. Chin osteotomy. Usually, plastic surgeons perform this surgery. In this process, plastic surgeons reduce or increase the size of the square chin. During osteotomy, the patient lay in local anesthesia or general anesthesia. In this process, surgeons cut the skin and then measure the bone with a special wire. Then surgeons remove the special part of the bone from the body with a surgical saw. After that, surgeons fill the space that occurs after the cut. Surgeons use different methods to fill this gap. Mostly, surgeons use tiny screws or metal plates to hold the bone in this place. These screws or metal plates remain permanent or are removed from the body. Sometimes surgeons use a bone graft to fill the space. This bone graft takes from the patient's pelvis. After these, patients keep in the hospital for a few nights. After that, patients get discharged. Usually, patient takes time to heal. For example, if a patient survives knee or hip osteotomy, he cannot move or walk for a few months. Such patients have to walk on crutches. Some patients have physical therapy, so they recover fast. If someone survived jaw osteotomy, he had to use only liquid food for 6 weeks. Suppose any of the patients survive from toe osteotomy. He cannot wear shoes for several weeks. Normal risk factor of osteotomy are blood clots, infection, joint stiffness, nerve damage, scar tissues, chronic pain, and artery damage are included. If you want to watch separate videos on osteotomy, so let us know in the comment section.